Can scoliosis cause kidney problems? There are different types of scoliosis, and most cases involve something called idiopathic scoliosis. And this is where the curve typically bends right in the thoracic spine and left in the lumbar spine. Right means to the right side. That means it's moving away from the heart. There are types of scoliosis called atypical scoliosis, and when they bend the opposite direction, meaning they bend to the right in the lumbar and left in the thoracic spine. This means that the spine is bending more towards the heart. In these types of cases, sometimes we see more significant findings that occur with patients that could affect more functions or associated with organs. Now, even though scoliosis can affect kidneys, this is not considered a common effect, even in cases that potentially have atypical scoliosis. However, I would say it's more likely in a patient with atypical scoliosis because we tend to see more significant problems associated with atypical types of scoliosis cases, and potentially in cases that are particularly severe and are left untreated. Now, when we look at scoliosis, which ones are most likely to affect the kidneys? Now, congenital scoliosis is a particular type of scoliosis that's not idiopathic. Idiopathic scoliosis means that the scoliosis is happening for no known reason. However, congenital scoliosis occurs because something happens in utero. In utero, one of the bones of the spine doesn't fully develop, and it develops into an abnormal shape. Patients with congenital scoliosis have additional congenital anomalies associated with their scoliosis, so they need a comprehensive assessment other than just looking at the spine. These other conditions can be severe, associated with congenital anomalies to other organs and tissues, so therefore we have to look to see if any of these other things could potentially be occurring. So patients with congenital scoliosis that is left to become more severe over time could and may have more kidney involvement associated than ones that do not have this type of scoliosis. And this can be a result of this congenital anomalies or a result of compression, because as scoliosis gets bigger, it causes uneven forces to the body. And these uneven forces causes the body to have to adapt, and organs have to change position relative to the curve becoming bigger. As these curves become bigger and they start compressing nerves and potentially compressing tissues and organs, it can disrupt whatever organ is being affected by the space. In a thoracic curve, an upper curve, it's more likely to affect the lungs. Like a lower curve is more likely to affect kidneys and bowels. So therefore, when we look at a scoliosis developing in the lumbar spine, not only can it affect the spacing that's associated with these organs, but it can also start to affect the nerves. And when we affect the nerves, it can start now affecting the organs that affect that area. So in the lumbar spine, we're looking at bladder, bowel, urinary, and potentially kidney function that could be affected as a result of scoliosis occurring in this area. In addition, that not only do these scoliosis cases potentially cause a compression as a result of space, it can also affect body symmetry. And body symmetry in children affects postural changes. And these postural changes affect the way the body appears. Now, postural changes include uneven shoulders, uneven hip, uneven waist, but a development of a rib cage arch, and normally a predominant lean to one side. As postural changes become more severe in children, it can cause a reactionary effect that the space available for those kidneys in the area leading to this asymmetrical compression can make kidneys more vulnerable, not only to injury, but damage and also compression. So when we look at anything that becomes severe in scoliosis, it starts causing more and more problems. Some other problems that scoliosis can lead to is a widespread disturbance to postural changes, and this can cause issues not only to balance and movement and coordination and gait, but it can also lead to digestive issues, irregular menstrual cycles, headaches, migraines, and scoliosis can range anywhere from mild to very severe, and typically the more severe the condition is, the more serious the effects are. Now, in all these other symptoms that potentially could be associated with scoliosis, whatever the symptom is, If it's a problem resulting of the scoliosis, the best way to improve the problem is to address the underlying cause, which would be the scoliosis. So therefore, whether it be a kidney problem, a digestive issue, a urinary problem, if it's a result of curve increasing size, either causing compression or nerve compression, the best way to deal with it is to reduce the scoliosis. Now, in conservative treatment, we work on improving and reducing the effects of scoliosis by really dealing with the size of curve. And we normally deal with this by impacting the scoliosis on many different levels. We look at structural, we look at muscle, and we look at tissue. And we do this by combining the power of chiropractic care, physiotherapy, physical therapy, corrective bracing, rehabilitation, home exercises to really address the spine on a structural level and helping all the other soft tissues to change shape with them. Bracing can really help by pushing the spine and body into a more symmetrical position, but it can't really help to increase strength and flexibility. Physical therapy and scoliosis exercises can help increase strength and balance to the tissues around the spine and the muscles, but they can't really try to focus on spinal mobility and alignment. Chiropractic care, therapy within the office using traction, neuromodulation, vibration can help improve flexibility and alignment of the spine. When we address and combine all these things effectively, we can get sometimes significant reduction in these curves and alignment. If scoliosis is addressed successfully with proactive treatment, issues such as kidney problems, colon problems, urinary problems may never ever become a problem and they never need to be a worry about. However, since we know kidney problems are not a common effect of scoliosis, if it's something that's occurring and you have scoliosis, and your scoliosis has become severe, or it's an atypical case or some type of congenital case, one thing we have to consider is that if we improve the size of curvature, could it potentially affect the organs that are being affected negatively as a result of this curve? Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.